10 traits that can happen 40 days before you die. Hello, how are you all? Come back to meet with me this time. We will talk about 10 traits that can happen 40 days before you die, which we as human beings are living beings. No one knows when death will come. Death is a natural mystery that can attack anyone unpredictably. However, in certain cases, there may be certain characteristics that a person exhibits at the time of death, especially 40 days before death. Why do we really recognize the signs of death in people? For the family and relatives left behind, this knowledge is an offer to mentally strengthen oneself and accept the separation of loved ones. Meanwhile, those who left can look forward to their return with more peace of mind. Signs that usually appear within 40 days of death are more likely to be seen in people who are seriously ill or have been seriously ill for a long time. However, it is very possible that some people who were in critical situations suddenly recovered and were able to resume normal activities before dying. His is not a magical phenomenon but a disease called final clarity. The following is for the character of a person 40 days before death. 1. Sleep more. Old people sleep all the time because their metabolism is weak. In most cases, a person who is very old or seriously ill is seen sleeping before dying. Before 40 days before death, the increase in sleep duration and frequency is caused by a weakened metabolism, although bodily functions are also weakened. If your loved one has any of these traits, don't disrupt their bedtime routine. This is a person's body's natural response to more rest. Help them sleep better by making sure the environment is quiet and the bedroom is comfortable. If they feel they have more energy, you can help them move around a bit in bed. 2. Appetite down. Rare food or lazy food is a common feature of people who are seriously ill and die within 40 days. Even a few days before death, a person may stop eating altogether. When a person is close to death, his body no longer needs as much energy as a normal person. In other words, appetite and drink also slowly decreased. However, it is important to make sure the person is still eating and drinking. If possible, continue with the food he likes. Apart from that, you can also apply lip balm or honey to make sure your lips are not too dry. 3. They don't want to meet or socialize with other people. When death approaches, people generally hesitate to meet other people. Healthy people, both extroverts and introverts, want to socialize and meet other people. But a terminally ill person's desire to see other people may not be as great as it used to be. This desire to be alone is very natural. No one wants to appear weak and helpless in the eyes of others, especially those they love. If they have a specific request not to contact or see a specific person, honor that. And vice versa. If they want to meet someone special, fulfill their request. 4. Physical changes. Physical changes are perhaps the most obvious characteristic of a person in the 40 days before death. Some of the physical characteristics of a dying person may include lowering blood pressure, hypotension. The skin becomes discolored and looks like bluish patches, especially on the upper body. This happens because blood flow slows down. Abnormal heartbeat, tachycardia sign. Incontinence, frequent wetting the bed, because the urinary tract is no longer functioning optimally. Weak breathing rhythm. Skin, lips and fingernails turn pale or turn blue due to reduced blood flow. But then again, not everyone shows the above signs a few days before they want to die. 5. Muscles become weak. A person who is near death may experience muscle wasting. Muscle atrophy is the wasting and loss of muscle mass caused by prolonged inactivity. This is usually experienced by people who lie down for a long time due to severe pain so they cannot get up for a long time. When muscles weaken, light activities that were previously difficult. 6. Lower body temperature. 40 days before death, blood flow is only focused on maintaining important vital organs such as the heart and brain. That is, only a small amount of blood flows to the hands and feet. When blood circulation is no longer normal, it's natural for the skin of the hands and feet to feel cold. In addition, the skin also looks pale with bluish or purple spots. 7. Dizziness. Older people are often confused and have trouble thinking coherently. The human brain can function properly until the last second. However, often the person feels confused or unable to think coherently. The people involved should always try to communicate and explain what happened, even the smallest detail. 8. Hallucinations. In addition to confusion, people who are almost dead can also experience hallucinations. They can hear or see things that healthy people cannot. This happens because brain cells slowly stop working. In this crisis phase, hallucinations are very likely to occur. 9. Experiencing more intense pain. Patients may also experience more pain 40 days before death. Because of this, patients sometimes complain about pain when the pain is unbearable. At this stage, doctors usually try to make the patient comfortable at the last minute. 10. Changes in vital signs. As death approaches, the vital functions of the human body change. For example, blood pressure drops just before death. In addition, changes in breathing become more pronounced, e.g. breathing becomes shorter or harder, heartbeat becomes irregular and difficult to recognize. When your blood pressure drops, your kidneys stop working too, so at this point you may notice that your urine is a darker color. Those are the 10 characteristics of a person which can be known 40 days before he dies. I hope this video is useful. Don't forget to like and subscribe. See you in the next video. Thank you for watching.